director of the COVID task force at Piedmont Healthcare. Dr. Morgan, good morning. A Merry Christmas to you. Thanks for making time to be with us today.
Good morning. Merry Christmas, Jessica.
I want to get your take first on these new CDC guidelines. Healthcare workers with COVID-19 who are asymptomatic are going to be allowed to return to work after 7 days with a negative test, and that the isolation time can be cut further if there are staffing shortages. Do you believe that was the right call?
So I think when we look at the infectivity of this particular virus, we really see the greatest amount of infectivity really at the onset of symptoms. But that infectious time can begin 1 to 3 days before the onset of symptoms and then taper over the next 7 days. So you really have an infectious period of about 10 days. However, narrowing it down to 7 days, since we know that the peak is at the onset of symptoms, certainly makes sense, and certainly makes sense for healthcare workers who will be donned in the most absolute PPE possible while they're at work, unlike others. So absolutely, I think this was the right call.
And I want to talk to you, too, about specifically what's been going on in Georgia and what you're seeing. Over the past week, there's been an increase of COVID cases and hospitalizations there, like we're seeing in so much of the country. I'm curious what you're seeing inside hospitals and how you would gauge things right now on the ground in Georgia.
What we see in the state of Georgia is in this past week, in comparison to last week, we see a fourfold increase in cases in that 18 to 29-year-old demographic and a threefold increase in cases in that 30 to 39-year-old demographic. We see a parallel with regard to hospitalizations, although somewhat decreased. And so what we have to remember is that our youth, while fairly protected because of their age, are not invincible. And we have to begin to consider taking that seriously as we look at not only this variant, but other variants that continue to challenge our healthcare systems, challenge our vaccines, and challenge all of our medical therapeutics.
Right, right. And it is, of course, Christmas Day, as we noted at the beginning of our interview. And despite this surge that we're seeing right now, so many families are still getting together. Of course, they've maybe missed their family for 2+ years now. A lot of people trying to get tested. We saw the lines, though. It can be impossible to get your hands on one of those at-home tests. What should people be thinking about as they get ready to see their families today, even if everyone has tested negative or is vaccinated?
So that's such a great question, Jessica. And obviously people get together yesterday, Christmas Eve, and today. And we would like to see everyone not only doubly vaccinated, but boosted. And so we want to see that with both the Moderna and the Pfizer, as well as the Johnson & Johnson vaccine. Further, if you're able, have a negative COVID test. Also, try to curtail your activities 2 or 3 days before you are going to attend an event. Hopefully that event will be a small, contained, intimate event and not a large gathering where there may be mixed people whose vaccination statuses are unknown. So have situational awareness, understand who is around you, and then mitigate your actions accordingly.
Right. And so many people out there are going, oh, I can't believe we're still thinking about this. But you make such a good point. You just have to kind of continue to calculate as we navigate our way through this new variant as well. I also want to ask you about, we're seeing Omicron cases in South Africa that were falling as quickly as they rose. So kind of this sharp up and down. Do you suspect that's going to be the case here with Omicron?
And so that's very interesting. And obviously we are a global society, but our society doesn't exactly here in the U.S. parallel that of South Africa. We do have a higher vaccination rate than they had at the time that Omicron hit, but they also had a higher native immunity rate, meaning more people have been infected with regard to the percentage of their population. Now, what that means in comparison, it may mean that we can't compare apples to apples, that this is really apples to oranges as we look at our demographics with regard to those demographics in South Africa with regard to Delta and Omicron and how many people had already been exposed and how many people were already vaccinated. So we'll wait to see.
Yeah, and is there any way to know at this point how long this wave could last? I mean, we saw Delta, the sustained wave that we're still dealing with. Some hospitals still overrun with Delta patients. How long do you see this playing out, or is it impossible to know at this point?
So I think our focus should absolutely be not only on this variant, but on the unvaccinated, where we continue to see these variants emerge. And so the question maybe is less how long will this surge last, as opposed to what is our next surge that will certainly come if we cannot get people vaccinated for whatever reasons around the world, that we have large populations of people who are unvaccinated and we continue to have these variants develop. If you remember, the Delta variant, when it came along, was different from Alpha and Beta in that that viral load was so high that we once again had to replace our masks because even the vaccinated had the ability to transmit this virus. And now we have Omicron, and Omicron not only is more contagious, but has the ability to partially evade our vaccines and our monoclonal antibody therapies. We now have only one monoclonal antibody therapy that is shown to be effective against this particular variant. And so we must continue to encourage the unvaccinated to get vaccinated, or we certainly not only will deal with Omicron, but we will have other surges, and we continue on this merry-go-round on and on and on.
Yeah, no question about it. All right, get vaccinated, get boosted. Dr. Jane Morgan, thanks so much.
Thank you. Merry Christmas.
Merry
Thanks, Jessica.
Christmas.